trained manual physical therapist, here to give you some information about how to treat your own shoulder if you're having shoulder problems. For example, especially if you had surgery or you're going to be pre-surgical, or if you have the beginnings of frozen shoulder or you're concerned about it, the motion that your glenohumeral joint, your shoulder joint, needs to do, there are 7 main motions. I'll call them 7 motions of Spencer, who was an osteopathic physician back at AT Still University at the osteopathic school, and so he was all about making sure that the glenohumeral joint would work properly. So the very first one, and you can do this yourself, so I'm going to demonstrate. We're going to use the right arm, and we're going to use weight bearing. You're going to place your hand on the edge of a table or desk, and you're going to lean into it, and you're trying to get the extension of the shoulder. So I can put my hand here, I can lean forward, and you can see that I get extension of my shoulder. So first we're going to push the extension, hold that, let it relax as far back as you can get it. Okay. Then the next one we're going to do is going to be flexion of the shoulder. So again, you're going to put that down on the table or whatever surface you can get to, and then lean forward. Try to reach your arm away from you. So try to reach that arm away from you, getting to here. Right, you're really going to feel a lot of stretch through there. Trying to get that flexion. You can help that also by placing your opposite hand on top of it. Okay. Your next one's a little bit dicier, so you're going to have to kind of watch here. So you're going to put your arm in front of you on the surface. You're going to do a circumduction with compression. So you're going to put a little bit of weight down into the shoulder, and you're going to try to do as big of a circle. Go through the whole range of motion that you have, and then of course go both directions. The next one may be more difficult. Okay, you're going to grab onto hopefully the side of a surface, and you're going to do that same rotation. Use your opposite hand to get the circumduction, right? That circle of motion that we call, that's what we call circumduction. So try to get a full circle of motion, okay, by holding on with this hand and grasping with this hand. You just go to the edges of your range of motion. Okay. The next one is going to be abduction. Abduction means bring your elbow away, really, is what that means. But what you can do is place your elbow on the table. So now I'm going to do it. If you were looking at it sideways, okay, or you were looking at me straight on, you'd want to do this one, and you'd want to put pressure on that and hold. Go down as far as you can. Okay. Okay. The sixth one is going to be internal rotation. So you're going to put your hand as far behind your back as you can. Ideally, reach across with your other hand and pull your elbow forward. You're just going to kind of mobilize that. Now, there's a couple different strategies that you can use. So far as, are you compressing and stretching, or are you doing repetitions of said motion, right, to increase the motion? The big point of a lot of this is that we are trying to restore the lubrication of the joint, of all the ligaments and the capsule and the labrum in there. So that's a big point of all this. The final one, number 7, is what we call joint pumping. So you're just going to pump that joint by pushing your hand in there and kind of take it into what we want to call horizontal abduction. So I'm really doing a horizontal abduction, but bringing the shoulder forward. So I'm going to place my hand down. I'll show you sideways. The horizontal abduction would be that direction. So I'm just going to simply drop my chest and turn away from my right arm while compressing or pressing down with my opposite hand. And my fingers are right into where that joint is there. Okay, so I'm just going to do that. Now, this would be great if you could have somebody else do this for you, but you don't always have somebody else to do it for you. These are the motions you should be doing every day. Okay, good luck, and hit subscribe and like. Thanks.